interlobar sequestration. Now, okay, multicystic lesion. How is seen as multicystic lesion with feeding artery from the thoracic aorta and lesion, most likely that goes interlobar sequestration. Multicystic lesion with feeding artery directly from the aorta. Sure, there will be feeding artery directly from the aorta, or multicystic lesion with feeding artery directly from the aorta is seen in interlobar sequestration. Pulmonary sequestration. Sequestered lung segment not related to supplied by pulmonary artery. Sequestered lung segment not related to supplied by pulmonary artery. It drains into pulmonary arteries but not supplied by pulmonary artery. It is supplied by thoracic aorta branch. 41. Congenital lobe emphysema present in first few weeks of life. Congenital lobe emphysema present in first few weeks of life. The congenital lobe emphysema on the CT scan. Okay, question 42. Cavitated not seen in hematoma. Cavitated not seen in hematoma. For the scenario of a young male presented with gestational infertility diagnosed with Carter-Jenner syndrome. Young male with gestational infertility diagnosed with Carter-Jenner syndrome. 44. Male with gestational nasal polyposis and bronchiectasis which further investigate fertility assessment. Male with gestational nasal polyposis and bronchiectasis which further investigate fertility assessment. 45. Polycystic hernia causes lung hypoplasia. Polycystic hernia causes lung hypoplasia. 46. Rib notching is seen in carotid aorta. Rib notching seen in carotid aorta. 47. Recurrent pulmonary hematoma can become malignant. Recurrent pulmonary hematoma can become malignant. 48. With a feature of pulmonary venous hypertension, enlarged left atrium. With a feature of pulmonary venous hypertension, enlarged left atrium. This is pulmonary edema with venous hypertension. No, with a feature of pulmonary hypertension, enlarged left atrium. Question number 49. Patient underwent palliative chemotherapy taken septal lines with retinogular intestinal application in the right mid and lower zone, most likely diagnosed with hepatitis cardiomatosis. Patient underwent chemotherapy taken septal line with retinogular intestinal application in the right mid and lower zone, diagnosed with hepatitis cardiomatosis. Or nodular septal thickening is seen in hepatitis cardiomatosis. Taken septal line with retinogular intestinal application or nodular septal thickening is seen in hepatitis cardiomatosis. Question number 50. Air curtain sign seen in hematoma. Air curtain sign seen in hematoma. 51. Calcified pericardial cavity seen in tuberculous pericarditis. Calcified pericardial cavity seen in tuberous pericarditis. This is calcified pericardial cavity is seen in tuberculous pericarditis. Calcified pericardial cavity is seen in tuberculous pericarditis. 52. Male smoker with recurrent spontaneous pneumothorax, bilateral upper zone fine reticulation change with upper thin wall cyst and increased lung volume, likely diagnosed with Langerhans cytosis. Now look here. In smoker, the commonest disease is Langerhans cytosis. So male smoker with recurrent spontaneous pneumothorax in upper thin wall cyst and increased lung volume, diagnosed Langerhans cytosis. Again, Langerhans cytosis, the increased lung volume and Langerhans cytosis, whose recurrent pneumothorax, bilateral upper zone fine reticulation, upper thin wall cyst, upper zone, increased lung volumes, diagnosed Langerhans cytosis. Also, these are skeletal manifestations. Question 53. Sharp pain between the blade of the shoulder joint, mediastinal winding, most likely probably causes aortic dissection. Sharp pain between the blade of shoulder, mediastinal winding, most likely causes aortic dissection. Aortic dissection or aneurysmal dissection. Most common cause of pulmonary metastasis in child is nephroblastoma. Most common cause of pulmonary metastasis in child is nephroblastoma. The aneurysmal dissection now seen at the superior border of the heart in mediastinum with well-defined medial border and indistinct lateral border with which pushes the trachea upward, right bronchus main bronchus upwards. Diagnosis aneurysmal dissection. There is also aneurysmal dissection or dissection TBAK 1 with mediastinal hematoma. Here also correlate RD dissection. Correlate RD dissection. Question number most common cause of pulmonary metastasis in childhood nephroblastoma. To define acute respiratory distress syndrome, what is the first change usually seen in such a graph? Patchy ill-defined opacity. The acute respiratory distress syndrome, what is the first change usually seen on such a graph? Is patchy ill-defined opacity. In hyaline membrane disease, what is the first feature usually seen on such a radiograph in initial state? Granularity in both lungs. In hyaline membrane disease, what is the first feature usually seen on radiography at initial stages? Granularity in both lungs. Which time pneumothorax occurs due to cannulation of which vein? Subclavian vein. Non-respiratory syndrome, first change is seen as granularity in both lungs. Pneumothorax occurs due to cannulation of which vein? Subclavian vein. Pneumothorax occurs due to cannulation of which vein? Subclavian vein. 57. 3-year-old girl with spherical mass in the posterior left lower lobe with slightly ill-defined border and ill bronchogram, most likely diagnosed as pneumonia. 3-year-old girl with spherical mass in the left lung lobe or right lung lobe with slightly ill-defined border and bronchogram, diagnosis pneumonia. Spherical mass, pneumonia. 59. AZ or pathogen at the upper border of the lower lobe of the right lung. AZ or pathogen at the upper part of the lower zone of the right lung. Horizontal pressure run from the right hilum to 8 rib and mid-axillary line. Diagnosis middle lobe collapse. 60. Ill-defined opacity in the right mid-zone, occurring in the hot border, thin wedge-shaped opacity with base in contact with the pleura anterior-inferiorly and pointing posterior superiorly, most likely diagnosed right middle lobe collapse. Ill-defined opacity in the right mid-zone, obscuring the hot border, thin wedge-shaped opacity with the base in contact with the pleura anterior-inferiorly and posteriorly superiorly, most likely diagnosed right middle lobe collapse. Ill-defined opacity in the right mid-zone, occurring in the right hot border, and on wedge-shaped opacity seen on lateral view, diagnosed right middle lobe collapse. Question number 461. Hodgkin lymphoma involvement of which extraneuronal site is associated with worse prognosis, small intestine. Hodgkin lymphoma involvement of which extraneuronal site is associated with worse prognosis, small intestine. There is two chest X-rays with consultation in the left lower lung. What should be done next? CT with this contrast. Chest X-ray shows consultation in the left lower lung. What should be done next? CT with contrast. 63. Chest X-ray shows bilateral lung hypertranslucency and decreased vessel causes bilateral emphysematous bullae. Chest X-ray is bilateral lung hypertranslucency and decreased vessel cause is bilateral emphysematous bullae. 64. Chest X-ray shows double hard border and splaying of cranial causes ventriculomegaly. Chest X-ray shows double hard border and splaying of cranial causes ventriculomegaly. Chest X-ray shows double hard border and splaying of the cranial causes ventriculomegaly. Question number 64.5. What type of ectasis occurs in carcinoma bronchus? Resorption. What type of ectasis occurs in carcinoma bronchus? Resorption. 66. Most lethal complication of foreign body intestines or obstructive oral inflammation. Most lethal complication of foreign body intestines obstructive oral inflammation. The other foreign bodies: foreign body bullet in the eye globe, foreign body in the nasal cavity, foreign body in the pharynx, foreign body in the esophagus, and then this is again retropharyngeal abscess. Again foreign body in the eye globe, again foreign body in mediastinum. And the next question number 67. Smooth oblique indentation of the posterior wall of the esophagus most likely causes aberrant right subclavian artery. Smooth oblique indentation of the posterior wall of the esophagus is aberrant right subclavian artery. Anterior wall indentation, aberrant left subclavian artery. Again, aberrant right subclavian artery. Smooth oblique indentation of the posterior wall of the esophagus, aberrant right subclavian artery. 68. Shortness of breath and hematitis, a triangular pleural-based opacity in the right mid-zone with epicyclic effusion, one will again most likely help in diagnosis, CT pulmonary. Shortness of breath and hematitis, a triangular pleural-based opacity in the right mid-zone with epicyclic effusion, one will again most likely help in making diagnosis, CT pulmonary because we suspect pulmonary embolism. 69. Intravenous drug user with pyrexia, systolic murmur, elevated white cell count. Multiple opacities in the mid and lower zone, some are cavitating, most prominent explanation is transesophageal echocardiogram. It may struck future, so most likely that impacted endocarditis, and then multiple patches in the mid and lower zone, most likely upper next investigation, transesophageal echocardiogram. 71 sickle cell disease, blood through anemia, paramecial mass with widening of the rib cages, most likely diagnosed extramedullary hematopoiesis. One sickle cell disease, on Chesapeake APView, there is paramecial mass with widening of the rib spaces, most likely diagnosed extramedullary hematopoiesis. 71 most radiographic findings in the uncomplicated myocardial infarction is normal chest X-ray. No most radiographic findings in uncomplicated myocardial infarction, normal chest X-ray. 72 ptosis, myosin, and anhidrosis most likely found on chest X-ray will be erosion of first rib on right side. Pancreas tumor, ptosis, myosin, and anhidrosis most likely finding chest X-ray will be erosion of first rib on the right side. The pancreas tumor. Pancreas tumor, erosion and destruction of left upper rib, scapula, clavicle, encasement of pulmonary parenchyma of left upper lobe, tract remains deviate till skin may be seen. I'm ready to see the involvement of supply